Well, good morning, everyone. Thank you for joining us for this session this morning in this brave new world of Zoom meetings. I appreciate that at any given moment, there's about an infinite number of virtual things to be at. So we're deeply grateful to you for your time and attention in joining us this morning. My name's James. I'm a coordinator at the Center for Research on Health Equity and Social Inclusion. But my job today is really simply to introduce you to Jennifer and Abe, to ask them a few questions for the benefit of all of our learning. In case you don't already know them, Jennifer Martino is the executive director at the Crouch Neighbourhood Resource Centre, and Dr. Abram Oudshoorn is an associate professor at the Arthur Labatt Family School of Nursing at Western University. As we go along, please share any questions that you have for Jennifer and Abe in the chat box. We'll be using that chat box as our primary Q&A. So at any point during their conversation, please feel free to put your questions in there. Jennifer and Abe will probably talk for about 30 minutes or so, and then we'll try to work through those questions and that feedback in sequence. So to begin, Jennifer, can we start with you? And maybe, as we look at unpacking this report and learning through it together, could you just kind of take us back to the very first piece of the puzzle? What prompted the question that led to this project?
Well, Abe and I were both participating in the Mayor's Task Force on Social Recovery that was launched fairly early in the pandemic. And he mentioned that there were opportunities to explore pressing questions that frontline service providers had around what we were seeing as a result of COVID, and especially with vulnerable populations. And right away, the question that came to mind for me and for Crouch was that we had a very significant increase in the number of people who were accessing basic needs services, ultimately 35% increase. And for a small organization, that is very significant. And we were wondering if this was an isolated incident, if it was strictly because of COVID, or if there were other reasons that people were finding their way to Crouch, and especially to our COVID relief programming around food security, and to know if there were ways that we could better support them going forward, or to continue to engage them. And I think it's really important when you're providing frontline service to be responsive to the community and do a little bit of exploration around how people end up at your doorstep, whether that's virtually or here at the Crouch Library, and then to make sure that you know what other needs they might have so that you can respond holistically to the situation that they're facing.
Abe, how did that process of connecting from just thinking in terms of the academic and the community collaboration that's at the root of this?
Yeah, so as a member of the Center for Research on Health Equity and Social Inclusion, that research center exists fundamentally for this kind of collaboration. And so one of the challenges, of course, we have in academia is the disconnect between research and the real world. And so, CRHESI, the research center, is built on this idea that we need to immerse ourselves in collaboration if we're going to be, quick and responding to these real world problems. And so it's actually a really ideal situation for me to have Jennifer as a community provider come to me and say, hey, we've got this thing happening and we want an answer to what's going on here. There was also some fortuitous timing around some funding that the Social Sciences and Humanities Research Council had put out for COVID-related projects as well. And so that timing was very helpful too. And it's really, for us, that you're not going to create change if you're not answering questions that are the most pertinent to the folks who are delivering the service, right? So we can do really excellent knowledge creation and figure something out, but if it's not an issue or a question that service providers have, then who's going to do anything with that? So and the other thing that was really, I mean, that pulled me into this project was that there's just an interest on the topic, I think, to me and to anyone else, to say, okay, you have a whole bunch of people showing up for community supports early on in the pandemic. What's happening? And I think, there was so much discussion about, what might be happening, what could happen, that I think there's just this natural curiosity to say, okay, what does this tell us about poverty in the pandemic? Is it that a whole bunch of people are becoming newly in a tight spot, or are these folks who have been living in poverty, or is something else going on? Are people moving from one spot? I mean, it's just such a curious question that I was excited to try to unpack it.
A quick question then, just as we're wrapping our heads around the initial launch of it, do you want to say a few words about the nuts and bolts of the research itself, the data collection, how those questions were formed?
Yeah, so I mean, it created so I mean, obviously, pretty straightforward is we had to talk to the folks accessing the service, right? That was, to find out who they are, what was going on in their lives, where they came from, where they were going. We just had to talk to them. Now, of course, the pandemic threw up a challenge in that area in terms of getting into the space to connect with them. And so this was another really neat part of the collaboration where Jennifer's team took on a good portion of the data collection, especially I'll talk about two phases of the data collection, but normally whereas we would be going in, as that kind of third party to collect data from folks, she was able to rally and train her team to actually hand out surveys with people. So really, the method was a mixed quantitative and qualitative survey where folks could, let us know what was going on, answer some questions about how they were doing and what their concerns or opportunities were through the pandemic, and then some demographic information as well. Now, the interesting part of that was the answers that came out of that were a little bit puzzling, and I'll talk about that when we talk about our findings. And so I had some hypotheses, and again, Jennifer and her team were really helpful in helping us kind of unpack what was probably going on in that data. But we just felt like we needed more in-depth conversation with folks as well. So what we ended up doing is a second phase where we did in-depth interviews with a number of the CRHESI folks. So we ended up with 47 surveys and then subsequent 14 individual interviews, basically kind of to sort of member check our preliminary ideas about what we might be seeing in that data. So I don't know, Jennifer, if you wanted to talk a little bit about having your staff do the data collection and that kind of side, because I think that was something new for you guys too, right?
Yeah, and it was a really good opportunity for frontline staff to learn about where this type of data comes from. And they got a lesson in research methods very briefly from yourself, Abe, and they were actually quite excited to talk to the community members that we've been supporting prior to COVID, but also the people who were brand new to the center, and to find out what it was that drew them to Crouch and to the COVID Care Kit project specifically. And I think that the addition of the more in-depth interviews was nice because that was arm's length and we weren't the team that executed those interviews. So it gave people a chance to speak about the services and what they would like to see in the future in more depth, but without having to speak directly to Crouch staff about that. I think it was a good mix. Of course, when you're asking people, especially when they're facing a host of challenges, to participate in something like a research study, relationships help a lot, and being able to provide a safe space to do that, a familiar face, and then give them the opportunity to go deeper with somebody else, but to make a warm introduction, I think was the key to getting responses.
Jennifer, on that point, do you feel like in shifting that role momentarily from service provider to kind of this data collection role, how do you navigate that without without shifting the nature of that client provider relationship that's taken time to generate?
Yeah. I mean, I think part of it is how the survey was designed, and it was really designed as a check-in. How did you end up hearing about the COVID Care Kit project? Were you someone who's already engaged with the project, or were you new to the center? It wasn't an evaluation of rate Crouch on a scale of 1 to 10. I think that would have been a very awkward shift in roles. They were being asked more about their challenges and the circumstances that were most difficult for them over the course of the pandemic, and what they would like to see going forward. So these are the kind of questions that we ask people every day, because we want to be as responsive as we can to their needs. And I would argue that it's very difficult to have a meaningful relationship if you're not checking in with how that relationship is going and how it can be improved. So the difference here was that having the support of CRHESI and the research study and Abe and his team, that we were able to record that data in a way that would be very useful, instead of more of ad hoc conversations that we would then bring to our team meetings.
Great, thank you. So for this next section of our conversation, you could imagine hypothetically you're on a Zoom call with 33 people who are curious to learn about the results and findings of the study, hypothetically. So I just wanted to turn it over to you for 10 or 15 minutes for you just both to have a conversation, just highlight the pieces that came out of this that you would want to share with those 33 people.
Well, I'll start with a confession that I had an assumption about what we would find, and it wasn't the primary case. And so, of course, Jennifer could have probably corrected me on this earlier, because she's on the ground talking to folks. But my assumption was an increase in access of basic needs support in the pandemic would be a reflection of new financial crisis. So what was really making the news at the outset was about things like job loss. What are the recovery benefits going to be? What is EI going to look like? What's going to happen to folks who are in gig work, and that there's this concern about how many people are living paycheck to paycheck, and is the pandemic pushing a lot of people into financial crisis or poverty. And so that's kind of that was my assumption going in, right? Was that this is the story that we're going to find, is that the pandemic creates an economic crisis. However, our first round of survey data, the majority expressed that their economic status was about the same or even a little bit better since the start of the pandemic. And there were a few who had gotten significantly worse, and this was primarily those in gig work. But for the majority, it was the same or a little bit better. And to me, that was surprising. But it starts to be explained when you look at where folks' income was coming from. And so the majority of the participants were on fixed benefit of some kind. So whether that's Ontario Works, Ontario Disability, CPP, or some mix, old age security. And so what had happened with the pandemic is that those rates had stayed the same. And then there were also a couple little bumps. So there was one basic need increase for Ontario Works, a one-time, and there was a couple additional child benefit payments as well. And the other thing we heard was that people were, in terms of their overall well-being, they rated it fairly good, again, with some very specific frustrations. And some of those frustrations included things like transportation and access to services. And so this is the data I took to Jennifer and her team, and I was like, I think something else is going on here. I don't think this is a story about new experiences of poverty. I think it may be a story about what it's like for folks already living in poverty when a pandemic hits. So I don't know, Jennifer, if you want to talk a little bit about kind of what you helped explain to us as we were thinking about doing those second round of interviews.
One interesting thing about the COVID Care Kit project was the breadth of ages that we had as part of the project. I would say, after looking at our service data, that the majority of people, or a large percentage of people who were absolutely brand new to Crouch, were coming from seniors buildings or complexes that are predominantly seniors. And those folks were really, really nervous, for very good reason, about leaving their homes. Especially at the beginning of the pandemic, we were telling people, I think it was 70 and older, not to leave their house. That works fine if you have a social capital. It works fine if you have a strong support network of family or friends, or if you have the financial resources and the digital know-how to use a service like Instacart, or if you have your own vehicle and you can drive to the grocery store and do curbside pickup. For the people that were reaching out to us, none of those things were true. So they may have a close friend network, but those people are generally in the exact same situation that they were in. Some of them said, my family lives very far away. We had family members from as far as Edmonton contacting us and saying, my mom is completely isolated. I can't help her. And I'm very concerned about her food security. And she doesn't have a vehicle. So for folks like that, getting on a bus to go wait in a line at a grocery store when they're being told to stay home, it just wasn't an option. The other group that we saw really increasing their use of our services are people for whom transportation was an issue if their age wasn't an issue. But again, services like Instacart just simply weren't available to them. And the other thing is that there are a lot of people who utilize multiple services in 1 week. So they were going to multiple hot meal programs. They were going to a place like the food bank, and then also visiting an emergency food cupboard. And overnight, a lot of those services disappeared. I don't know how many stayed available, but I would say it's a very small percentage. And some of those services actually have not come back to this day. So for those folks, having a weekly delivery of protein, produce, and the dried goods, the non-perishable items, was really a game changer. If you go from having a few items that you're able to gather from food cupboards in the food bank in your home, if you do have access to a fridge or to a freezer, and then relying on meal programs for the rest of your subsistence, suddenly when those things go away, if somebody doesn't bring food to your door, you are in an emergency situation very quickly. And at the height of this program, we were serving more than 250 households and more than 750 people every single week. The other thing that they were looking for beyond food were hygiene items, especially cleaning supplies. And there was a run on things like toilet paper, and also on things like diapers, formula. You just spray to clean your house, the Lysol spray, if you remember that. So panic buying also created a challenge for people who couldn't possibly visit multiple stores and pay extra in order to access the items that they felt they needed, but also that the media was telling them that they needed.
Mhm. So what I started to think about then is to get my shift away from thinking about pandemic poverty and instead think about endemic poverty. And so it's that idea that in our community are thousands of people living in poverty and day to day kind of living on the edge of meeting their needs through other meal programs like Jennifer mentioned, supports to get food to where they are or to get them out to shopping. And then along comes the pandemic, and it doesn't change their income status, which is already too low, I would suggest. But it changes the way that they can get support and get assistance. And it creates this new crisis of need because of the lack of service, the lack of being able to safely travel and those sorts of things that Jennifer just talked about. And to me, this is really important because it starts to point then to, well, what do we learn from this? I mean, one thing we can learn is that, a lot of those government income supports, I think, are highlighted as effective in terms of keeping people's income at least the same or some small improvements. But the big picture it shows is just how catastrophically low our assistance supports are day to day, in the big picture. And so with insufficient income for families and individuals, it creates the necessity of services to have this huge network of services. And if a pandemic hits and you get pieces of that network that start to get knocked out, that has this catastrophic effect on people just being able to get food. And so, although this is a pandemic study, I mean, I think it tells us a much bigger story about poverty and what we've essentially created by having such low social assistance rates, and by having this dependence. It makes me think about the story the London Food Bank has been telling for years and years is, let's create a better system so that we don't need people as often to access what's supposed to be an emergency support. That's one of the things I really loved about Jennifer and her team in this project too, is they've always said, yes, let's look at what's happening now, but can you also talk to folks about the future? And as community developers, I think, Jennifer, I can speak for your team to say, yes, you want to be able to help people in their moment of need, but you also really want to just make a really strong, resilient, socially connected community.
And the social connection piece was another part of the report that I really enjoyed, and I'm glad it emerged kind of to the forefront, with people saying, I've been going to meal programs for a long time, and part of it is the food, but a big part of it is, if I don't go to those meal programs, where do I go? And there was one survey respondent or interview respondent who said, I couldn't go anywhere. I couldn't go and get a coffee. And so if you compound living in a place like a boarding house, where it's not a particularly comfortable environment, you might have access to 1/5 of a fridge because there are 4 other adults who also need to stock up given the emergency that was happening, and you don't have internet. You may not have a single device, or you may have a phone that doesn't even have data. And so the only information you're receiving is what you're hearing from within a greatly reduced circle. And then you don't know, honestly, where you can go. We were being told to stay home, and that works well if your home is a place that is safe and reasonably comfortable for you. But I mean, I can't imagine being in a boarding house situation for as long as we were asked to stay home. And so we find that even now, when we haven't been able to provide our hot meal program in person, people come about at least an hour early to line up outside, and it's a curbside meal. It goes pretty quickly once the meal arrives and we start handing it out, but they come to talk to each other. And you know, a lot of us dove into our online social networks, and we started downloading new apps like House Party, and we were, you know, having baby showers over Zoom, and it was isolating, but we were able to connect with each other in various formats. And for somebody who didn't have those options, losing a meal program is not just losing a meal, it's losing your entire community and the people that, you know, you check in with each day. And there are people who come to Crouch every day just to say hello. They don't take anything, but it's their check-in, and the feedback we receive about those relationships and what it means to those people is really important to us. So I was glad that that emerged as part of this study. And I think it further highlights why collapsing of services has a very detrimental effect to these folks, far beyond the meal itself.
Jennifer, I realize you have many moving pieces there at Crouch today, and that you might have to go shortly. But just before you have to run, I wonder if you could share maybe a few thoughts about implications for practice or advocacy or implementation moving forward.
Yeah, I think the recommendation that we need to pandemic proof our social service sector that came from the analysis of Abe's team was important. I would also like to say that I really believe that every charity and nonprofit organization in this community did the best they could under exceptional circumstances. And it also depended on the regulations that you fell under, whether or not you could continue to provide service. So neighborhood resource centers are quite fortunate that, you know, especially Crouch is quite small, we're nimble. The team here was willing to pivot very quickly and keep coming to work at a time when they could have said, they're telling me to stay home, I just need to stay home. Our preschool coordinator volunteered to pack food and to organize the data for our delivery system. And that was totally different from the job she was hired to do. So a place like Crouch is able to be quite responsive because of the size, but I think we do need to look at, especially organizations and systems that fall under perhaps stricter regulations, especially provincial and federal regulation. How are they empowered to continue to serve people in a responsive and nimble way? And virtual is not the answer. It can be the answer for some things like this webinar, but it's very difficult to build relationships curbside. And we know that relationships are critical, not just to meeting someone's most urgent need in that moment, but also supporting them in exploring how they might be able to move forward in a more holistic, broader sense. I think that recommendation was important, as well as a recommendation to increase the amounts that people on social assistance get so that they are not reliant on, at any one moment, 15 service providers.
Hey, do you want to?
Yeah, I would echo those points for sure. And I would just, you know, add an illustration around, you know, when we say pandemic proofing the system, take for example, a church lunch program, you know, it's run by volunteer seniors, and maybe it's the only program in that particular neighborhood. And that's one of the things that Jennifer's team noticed, is they had folks coming from all over the city because there were certain neighborhoods that suddenly became these deserts of service. And so how, obviously we know seniors are a vulnerable population in the pandemic. And so are we ready for a service like that to pivot. And we weren't this time around. And so some of them simply did the right and the safe and the regulated thing and shut down. But could we think in the future, right, of how we might be able to change a service like that so they can do distribution in a safe way, for example? And then, yeah, again, echo Jennifer's point around the social assistance rates. I mean, in previous work with the London Homeless Coalition, we've been highlighting how these rates are so low that you can't pay for shelter and food. Surely, and they're set at for single adults, it's less than half the poverty rate. So it's just absurd that your basic assistance wouldn't cover those two most basic necessities. And so Jennifer highlighted that people want to socialize, they want to be together. And so they don't want to have to be running around just to meet the food part. They want to get together for after school programs and for reading programs and for men's programs and all the other programs that CRHESI would normally run. So, surely we can raise the rates to meet the cost of food and shelter, and then give people some dignity to focus on other things in their lives as well.
Shall we move to talking through a few questions that have come up through the chat? Jennifer, what's your status on time?
They're going to call me when they need me. So it looks like we're still okay for a few minutes.
All right. So if Jennifer jumps up and runs out of the room, you have a staff collaborator joining us, I believe.
Yes, we are very fortunate to be hosting the Harvest Lunch for United Way today. And it is also the day of our hot meal program. But what is very special about today is that everybody who comes for our hot meal will get to order their own food. Speaking of that choice, that is so important and we're not often able to offer. So I might need to pop out for that reason in a few minutes, but it's a really good reason to have to go outside.
Absolutely. So a question that came up in the chat was what questions were asked by the community? So we've kind of talked about some of the questions we've asked, but in those conversations, can you think of any questions that were asked in the other direction?
The one that really stood out to me that we haven't talked as much about is frustrations people were having around transportation and just questions they had on that and that idea of how am I supposed to move around this city safely when public transit is my option and you're telling me that I shouldn't be in enclosed environments with other people? And so how am I supposed to live, make ends meet, get things done, get my kids places? What could we do differently to help with transportation? That was a really good question. I don't know that I have an answer on that one, and it's one of those things where all we could come up with as a community was like, well, let's make transit free for a period of time. That doesn't solve the risk factor issue. And so I don't know. I've seen in other communities like very specific shuttle services. If you're in shelter, and some shelters in other communities are nighttime only. So they'll have, shuttle services in the morning to get people to other day spaces or other programs, that sort of thing. But yeah, a lot of people were asking, well, how am I supposed to get around this city and be safe? And I didn't have a good answer for them on that one.
The other question that we heard was, is it okay is it essential? Is it a good enough reason to need to access your food cupboard? When we did begin to provide services in the neighborhood, again, because we got access to our operating spaces on Hamilton Road instead of relying exclusively on delivery, when the emergency order came out and the stay-at-home order, and people were thinking that they would be stopped by police, that they would need a letter, and we had people call and say, you're not going to see me for a while because I've been told that I'm not allowed to leave my home. And at that point, that was actually quite scary for those folks and concerning for us, because we weren't able to indefinitely sustain a home delivery program. And we did a lot of work to assure people that food is essential and a good enough reason to tell anyone that you need to leave your home. But that's something that I'm quite confident doing if I'm stopped. And of course, they weren't actually stopping people, but it was kind of scary at that time. But somebody who's had negative interactions with the police, somebody who has been asked to stop trespassing or is a substance user, these things really affect their sense of security when they think, now here's an additional reason why I may be stopped and profiled and have to answer questions which could lead to other questions. And so I think when that stay-at-home order came out, this was a very unintended consequence, but it was a very big challenge for folks that are not as secure as they would like to be in our streets.
Thank you. Another question. I'll throw to both of you. It's a good question too. Could community members have been involved in collecting the data instead of center staff, or some research projects very much have data collection done by varying people in the project. But any thoughts on that question in the context of this project?
Well, from Crouch's perspective, it was a pretty significant challenge to keep up with the local guidelines around we had to write 4 different COVID policies within about a 6-month period. And this was also pre-vaccination availability. We really weren't sure how safe we were doing things as safe as we could, and we had PPE, but it was limited at that time. And so asking people to come in as volunteers and to interact with other community members in a data collection format, I don't think it's something that we were prepared for at that time. And then, I think that the other thing is a lot of the people who volunteer for Crouch are also people who access the services, which is something that we're really proud of and pleased with, but it means that they were facing a whole host of challenges like the rest of us. So we were really grateful for their participation in the project, but asking them to also collect the data, I think would have been a stretch.
Yeah, and we were under similar challenges here. So I had to apply to our associate dean research to get permission to run the project at that time. And we actually only got permission because Crouch staff were already in the service. And so we weren't adding any people to the environment to do the data collection. And we had to do all the training virtually and that sort of thing. So I think, yeah, bringing other people externally into the research, into the environment to collect the data would have probably been a no-go on our end on COVID restrictions. Now, of course, conceptually, and for future projects, and now that we also are in a different space with vaccinations and that sort of stuff, absolutely, inclusion of folks in that kind of a participatory research manner, for sure. It was just, the COVID restrictions were a little too complicated because this was done, last year when things were pretty intense.
I do have to step up now, but I'm going to swap out with Stacey Martin, who is a manager here at Crouch, and she was on the front line of the care package project and basic needs services throughout the time covered by this study. And so I just like to thank everyone. And I'm also putting a link in the chat because we are, as a little bit of shameless self-promotion, sorry, but Crouch and Glencairn and Youth for Christ are finalists for a Pillar Award in the category of collaboration for the project that the study looks at. And so I'd just like everyone to go take a look at that if you have a moment, because it really is a great example of community volunteers coming together with multiple agencies to change how our systems work in an emergency. So in 2 seconds, I'll be replaced by Stacey. Thanks.
Thank you, Jennifer.
Thank you.
Abe, I'm wondering, well, we're doing a change of personnel at Crouch. The idea of pandemic proofing services, I mean, I remember in many conversations around like disaster planning, scenario planning, you know, agencies, you know, we'd often think about, okay, you know, drastic cuts to funding or, you know, other kind of external factors that, you know, would drastically impact how an agency is able to deliver services. And I feel now, obviously, we're not going to be able to have those kind of conversations without having, you know, a column in that logic model that says, well, let's think about pandemics. So do you have thoughts about like what pandemic proofing might look like? And as I read the report, actually, I kept thinking about what we're seeing on our side in education and universities, where, you know, we're realizing that, you know, there's hybrid and flexible models of thinking about education, and, you know, moving forward, you know, we don't necessarily need to, you know, be locked into one mode of service delivery, but, you know, can think of about really adaptive and responsive ways to go about that. So I wondered if you wanted to unpack some of that thinking a little bit further.
Yeah, so I think it's a really great question, and it's complicated to the nature of each service. So there's some really good examples, actually, I think, from various homelessness systems across Canada that I've been researching as well, and doing things like city staff pivoting into to supporting their homeless services. Because if you have a whole division that is shut down because of the pandemic, well, you know, we can put these people on EI, or are there some who want to work in other areas where we suddenly have huge need for additional staff? Part of that need for additional staff is the regulations eliminating a lot of sectors volunteers, right? So you can still have your staff on site perhaps, but not volunteers. Okay, so now we're going to staff up with municipal employees. So, but again, that's a very specific example. And then the other is, like you said, the option for virtual. So, you know, depending on what the service provides, so for some after school programs, for example, depending on the age of the kids, those may be able to pivot online as well. A meal program, not going to pivot online. It doesn't work yet. So it's going to really depend on, I think, on almost each organization kind of looking at what they provide, and in a scenario where they have to very much limit on site, what can they replicate, and how are they going to replicate that? And I do think the food delivery program that Crouch did is a really perfect example of being nimble around, okay, you know, a large portion of these are seniors now shut in, fixed low income. How can we get this food to them? And literally getting on bicycles and riding it out to where people live. So that's that kind of individual service level thinking that I'm talking about. The other, of course, is the funding side. And United Way played a huge role in this by being the flow through for the pandemic related emergency funds, because there's big costs that come with some of these pivots, especially when organizations that are charitable organizations lose all of their fundraising activities all of a sudden. And so the other ways that we make that system pandemic proof is that we have that quick access to those funds distributed where that need is high. And I do like that model that the federal government and I think provincial adopted, where there was local decision making, for example, through the United Way, to really say, okay, what are these most crucial services that we can support with funds? Because sometimes it honestly is just the money to solve these problems. You know, we've lost all our volunteers. We need to hire more staff. Well, we need money to do that.
Hello, Stacy. Welcome.
Hello.
Talking through the pandemic proofing ideas, and I mean, I guess kind of what's potentially emerging as a category for future thought, which is what are best practices for pivoting. I guess when from a program management and program delivery perspective has coming not only out of this project but out of the pandemic itself. What are you thinking in terms of, okay, how do we, what are ways we can bake into the DNA of a program a way that it can kind of deliver core essentials, even if everything in the world in terms of ability to be in person, et cetera, gets reconfigured?
Yeah, well, especially with Crouch, we are a very dynamic team. So when the pandemic did hit, we just all brainstormed and worked through what we could do. And then we worried about making it happen. So we shot for the moon, per se, and thankfully we were able to be as successful as we were. Now going through things every time, like Abe was saying before, we're planning programming, but we're also keeping things like virtual in mind. How can we transition this and still support families? How can we bring it to them in a way where we're meeting their needs with no barriers? So if virtual isn't available, brainstorming other ideas, how we can get them engaged and support them with whatever it is that they do need.
Yeah, it's interesting. I mean, that barrier analysis, because whatever it is that is undertaken at any one point, there's usually a barrier for someone, right? So if it's an in-person thing, transportation can be a barrier. If it's a digital thing, digital access can be a barrier.
Yeah.
So
honestly, I think if we can permanently solve digital access, well, we're at it. That would pandemic proof a lot of things if we ensured that people in low income had internet and a device. Boy, I mean, the schools were huge in that. I mean, so much actually of what social service was able to pivot to was in large thanks to the schools giving out thousands of devices into the community. And then being able to use those to access service as well.
Well, thank you both so much for taking the time to do this very thoughtful retrospective and have this conversation. And thank you to everyone who participated in bringing your questions and taking a few minutes out of what is proving to be a very busy September, I think, for everyone to engage. Before we sign off, Stacy and Abe, are there any kind of final pieces that you feel didn't come up in the conversation overall that you feel that you'd like to bring forward? And if not, that's okay too. I just want to make sure that we've had an opportunity to touch all the bases.
I would just say, you know, from the academic side of things, just invite, because I see some academics on the call here, invite you to constantly be available to the community, throw out those offers. And this was just this fortuitous, we were in this meeting together. I said, you know, we're here for research if anyone needs it. Jennifer jumped up and down. So yeah, make those offers to the community constantly, and then you'll get picked up and get to do some really cool work.
I have nothing else. I think we covered everything greatly on this call. So
Great. Thank you both. And I guess a little plug for CRHESI is being a potential, you know, place in the community where, you know, we hope that these kind of fortuitous overlaps can happen, and we can, you know, help nurture and broker some of those connections and relationships that can, you know, lead to, you know, robust research around actual questions that are of interest and importance to our community. So thank you both so much, and thank you to Jennifer as well, who has obviously had to depart. And thank you all for coming. Have a terrific Thursday, and we look forward to seeing you all again soon. Have a great day.
Thank you.
You know,